talk about identifying your child's inflammatory illnesses, and I'm really going to get into some detail about what inflammation is, how do we identify it. So we're going to go back to our picture of our fella, and I'm going to use him as our theme throughout because these before and after pictures are just so critical to looking at and understanding how you can see inflammation. You can't always see it. You know, like blood pressure is something that you might have, but you don't see, and you don't always see inflammation. But again, with him, you see that really pale skin, the dark circles under his eyes, even his smile, it's not a clear smile. And then in the other picture, you see that good skin tone. He doesn't have the dark circles. So that's the difference of a system that is working efficiently and effectively. He's got good cellular health. He's got great digestion. What is inflammation? We think of it as pain, redness, swelling, mucus, rashes. We often will think of a sprained ankle or a jammed finger. And what happens is our body sends all of these white blood cells to that site in order to heal the tissue. Or if you cut your finger, right, we have to send blood cells to that site in order to stop the bleeding. So we need inflammation to a certain point. But what's happened is most people have far too much inflammation. And getting a little further into, you know, what is inflammation? Again, it's these white blood cells. When we have mucus, excess mucus, think about when you have a cold or if you have allergies, our body is just creating more and more mucus. And our system has to overcome that inflammation in order to function properly. So we're blowing our nose, right? We're taking medications to keep that inflammation at bay. Rashes are another big sign. In integrative medicine, we talk a lot about how our gut health impacts our body. And when we have all of these rashes, those are signs of inflammation. Eczema, rosy cheeks, diaper rashes, all that sort of thing. So I hope you have a really good idea of what inflammation is from that. And now the pharmaceutical industry really understands the concept of inflammation. We use all kinds of medications to decrease inflammation. We use topical steroids, oral steroids. We inject steroids. We inhale them through our nose. We inhale them into our lungs. And ibuprofen is a non-steroidal anti-inflammatory. We're decreasing inflammation from an external standpoint. And what we're going to do together is we are going to decrease inflammation from an internal standpoint using food and using a select few supplements. What is inflaming? Junk food. So a lot of the foods, the processed, packaged, fast foods that we eat are very inflaming. And we're going to talk about one of the first things that we're going to do when we get into the food is we're going to do a mini cleanse for kids where we're going to start to decrease the junk foods. And we're just eating things that really aren't food these days. And when it comes to inflammation and illness, so again, we need some inflammation. If you cut your finger, your body needs to stop that inflammation. But we just have, many people have too much inflammation. And if you look, especially American, we just look bloated and, you know, we've got, when we have the fat around our belly, those are signs of inflammation. And with that excess inflammation, think about runny nose, watery itchy eyes, congestion, eczema, bumps on the back of the arms, can even contribute to behavior issues, meltdowns, mood swings with kids. So another thing I want you to start to pay attention is when your child, for example, if they have a lot of allergies, does their behavior shift when they're having a lot more of their allergy symptoms? That can be this excess inflammation. So I always talk about it like a glass of water, and we've got our colorful glass of water here. And when the glass of water is overflowing, that's when we have all of our symptoms. And so what we're going to do together is, say your child has environmental allergies. Maybe they've got allergies to trees. We can't cut down all the trees and we can't dig up all the grasses. So what we're going to do is we're going to say, okay, let's decrease our inflammation from food. Maybe they have a dairy sensitivity that you don't know about yet. So if we take the dairy out, then we decrease their cup of inflammation to where it's only a half or a fourth full. So that when springtime comes along and they get exposed to their allergens, maybe their cup of inflammation only goes up to about 3/4 full. And they're not going to have nearly the symptoms that they normally have. I've seen hundreds of kids where we've been able to either decrease their medications or even get rid of them altogether, whether it's allergy meds, sometimes asthma medications, laxatives, many, many different medications, antacids. But we do it very slowly, and we do it by decreasing their systemic inflammation. This is a really great visual, and I've listed out the different inflammatory illnesses. So headaches, we can have snoring, mouth breathing, nasal congestion, wheezing, belly pain, loose stools, or constipation. We can have muscle cramps. These kids, some of the kids might get fatigued, while their friends can run and run and run, they might get tired and start getting fatigued. So when those symptoms are, that cup is full, often the symptoms are worse. And then when you look to the other side where we've got a less inflammation on the cup, that's where we get our symptoms being more minimal. And I'm not saying that we can get rid of all illnesses. The kids may still have asthma. They may still have, get headaches. We'll just get those symptoms so that they're as minimal as possible when your child's system is optimized, when they've got really good cellular health and good digestion, and they're eating the food that's right for their body. This is an example of an 18-month-old, and this family came to see me because of the eczema, but also his behavior was off the charts. He would have so many meltdowns. They had never been able to eat in a restaurant since he'd been born because he just would scream and cry and pitch a fit. And we modified his diet, and that made a big improvement with his eczema, as you can see. And also, probiotic made a big difference for him with his skin. But as we really got his food correct for his body, and then we added some of these supplements in for him, he was like a different child. And it was the best thing. At the last time I saw him, the family had been able to go out to eat the night before they came for their visit. So that was huge. And it's one thing I want you to start making those connections with these kids about when we get their inflammation down. Are you seeing improvements with their behavior, with their ability to handle transitions, things like that? This is another example. This was a little boy who came to see me. He was having recurrent croup and was needing to go on steroids. And he had a lot, you can see he's got the keratosis pilaris. So the bumps on his cheeks, and he has them on his arms. So you can see the photo with the before and after photos of the bumps on his arms. And you can see they're still present a little bit in the after, but it's much better. And you can also see he had really big improvements on his cheeks. And this is just another good example of how decreasing systemic inflammation, we can see the changes on the skin. And with this visual that we have, I literally want you to go through the issues that your child has so that we can see the improvements. Talk to the kids about it as well. I want them to understand what's going on, if they're old enough, because when they start to feel and see the changes in their body, we get their ownership, and it makes it a whole lot easier to shift the diet when we have the kids buy in. And it's going to help everyone in your family as you understand how inflammation impacts us. And when we are inflamed like that, it does not allow our immune system to work as effectively and efficiently as we want. And it doesn't allow our bodies, our gut, to absorb nutrients as effectively and efficiently as we want it to.